So thank you for inviting me. I think a bit unlike other people, what I'm going to report on is an actual experience of using accessibility planning and for a very specific objective, which is social inclusion in the UK, and how that turned out, how we conceptualised it, and some critiques of the outcomes. But I think that from what to sum up till now, I know we're not supposed to be doing that, but people are making it sound extremely complex, and there is that massive thing about complexity and uptake on the ground. And in fact, when you go and look on the ground, the majority of transport planners, certainly in the UK, don't have the skills, capacity or resources for these things. And if you look outside the Western world, it's even worse, and I think we should be thinking about that. But I also think that what I'm hearing very much is a real mixture between identification of the problem, identification of the solutions or formulation of the solutions, which could be transport or land use or anything in between, service sector, all sorts of things, and then evaluation of the outputs and the outcomes. So you might have an increase in accessibility for N% of the population, but the outcome might not be what you intended, which was social inclusion or whatever else. And I think we have to make the distinction between those things when we're talking, because I think that it's different analysis, it's a different focus, and that we should be clear about it. So, first of all, I'm going to talk... How do I do this? Oh, this way. So I'm just going to really, just as an outline, I'm just going to talk about accessibility and why it's important in the context of social inclusion, which you could also say social equity, although it's not quite the same thing. What we meant by accessibility in that specific context, something about the actual approach, although I won't go into great detail. It's not as complicated as what was presented by the DFT now, because things have evolved, and it is an evolutionary process, and it is a bit about watching this space. But actually, even with some much simpler ways of doing it, it was complicated. I'm going to just give you a few empirical examples of some research that was done, and then I'm going to offer you a bit of a critique around this and thinking maybe for ways forward. So this is dating back to 2003, so it's a really, really long time ago, and basically a report by the Social Inclusion Unit, so it's specifically for social inclusion, social equity, reported that transport might be a problem in terms of people's participation and that people were disadvantaged as a result of lack of transport, and that it was quite important proportions and that they were unable to access specific things. So again, there was a focus on what would be the inclusion. There was a huge emphasis on work, but also a recognition that it needed to be wider activities such as learning and health, because those were all seen to be things that would improve people's life opportunities and life outcomes. There was a clear identification of different groups between carless and with car households, because in fact 50% of the lowest income quintiles didn't have a car in the UK, and so that was clearly a large proportion of the population, and there was some sort of worst affected groups. And there was an identification through research that there was issues around lack of local services. So it wasn't just about transport, but there was inadequate transport, there was no alternative transport, and there was things about affordability and also cognition and lack of information about the system. And that's an important thing, because you can't access a system if you don't know what the system is. And it's very clear, as Andres said, this is the motility idea. It's about cognition of an appropriation of what you have in front of you. And just measuring opportunities does not necessarily say that people can uptake those opportunities, and I think that's an important thing that's often missed from the accessibility dimension. So by accessibility in this particular context, we were measuring public transport only, okay? We were measuring coverage, so that wasn't even measuring extra services like paratransit. It was specifically the public transport system, although paratransit could become a solution. It was thinking about the coverage, but it was also thinking about it's no good having a service you can't afford, and there were lots of places where people relative to incomes could not. So it's not the cost of transport, but the affordability of the transport, but also issues around safety and reliability, which significantly reduced accessibility. If people felt unsafe, they wouldn't go to a certain place, they wouldn't go at certain times of the day. And then you were very clearly thinking about which destinations, what travel distances were appropriate, for who were we thinking that was appropriate, and because we were thinking about not having journey time savings as a metric, but because of access being a form of double counting. So we didn't want to have it sitting alongside of accessibility by car, because if you were thinking about accessibility by car, you were already keep covering that in journey time savings. So it was working in parallel to look at the public transport system. So basically, the idea was here in the UK, the first thing that has to happen was you had to analyse the problem. What is the problem that you're looking at? Is it strategic? Is it local? Is it public transport journey times? Is it areas of deprivation? Who can't get where when? And then you had to think about evaluation of the options. And those options were not just about transport, but working with joint stakeholders to think about a range of options that could improve accessibility to key services. So it could be that you were having different opening times of a doctor's surgery because it would fit in with the public transport times. Or it could be that you were bringing vegetables to an outlying estate because they didn't have access to affordable food. Or it could be a land use planning option to build a new clinic somewhere or to have a new school. So it definitely wasn't about just having transport projects. And then you had these joint action plans to identify accessibility targets, so you would understand locally connected targets. And this issue about thresholds, how far is it appropriate for somebody to travel to work? I would argue that if the average population is travelling 20 minutes by car to work, then you shouldn't expect anybody else to be travelling more than 20 minutes to work. You shouldn't suddenly have thresholds that are way, way out of line with the local averages that are being spent at a time, but also with this affordability. And then it was about monitoring and evaluating the outcomes, and I think the outcomes in terms of social inclusion, right? So it wasn't the outcomes in terms of mobility or speed or whatever. It was about actually having outcomes that were about social inclusion, not just equity of the system, but inclusion. And I think that in some ways is quite important. And when we looked at the analysis of the problem, we're thinking about people and locations and their activity patterns. Florida, this should make you very happy. And then actually, sorry, I can't get the rest of that. It's an animated slide and it doesn't seem it's lost its animations. But at the top, sorry, above that, you were thinking about transport analysis, and at the bottom, you were thinking about land use analysis. Sorry, the slide's interactive here, but not on there. Oh yeah, okay, so yeah. So, hang on. Yeah, so looking like this. So different elements of the land use system and different elements of the transport system, and then thinking about people and whether they could meet their and reach their activities. And so I think that as you can see by the DFT presentation here, it actually has been mainstreamed and embedded within local transport planning, within strategic transport planning, and to a certain extent within land use planning as well. And it's audited annually. The DFT has statistics and metrics, and they're able to be published, and you can look at accessibility to each of the destination types, and you can see how it changes. We've got improved metrics and indicators and everything else that have been agreed nationally and are primarily, I would say, bought into by decision makers and politicians. We've got incredibly improved data sets. We're now able to get disaggregated metrics down to a very, very local census cell block, and connect it up with real-time information of the transport system and every part of land use. We even are able to put land use opening times, service quality. We can look at whether schools are well performing or not. Our analytical abilities are extremely good. And there are also more and more methodological techniques and case studies are available. It isn't impossible to do this. It must be said that it's quite time-consuming, and it tends to get passed on to consultants because consultants have got the time to do that for specific projects. So if you're a poor local authority who can't afford consultants, you don't do it very well. If you're a rich local authority who can afford to build a transport model that is interactive or singing, dancing like Transport for London, it gets done very well. But actually, the analysis is only the beginning of it. So you come up with all these analytical approaches, which we look at things like you just saw from the DFT, access to a specific destination within a given journey time, and you can see the percentage of the population nationally that's able to do things. You can do that at a local level or a regional level, so you can see this is Transport for London. This is a composite indicator which actually combines low income with affordability of a car, with availability to transfer into public transport, so that you can start looking at places with vulnerability. So you might have car users, but they might be older, and therefore you know in the future that they're likely, we talked about dynamics, that they're likely to change their ability to use the car, and so they're at risk of exclusion in the in the future. So you can look at potentiality. You can look at things like equity, because you can look at levels of accessibility between different groups within a place, between different places. You can use your Lorenz curve, your Gini indexes to do all of this sort of stuff. There's papers on all of this stuff in the academic literatures. The fact that have done some of them is neither here nor there. And then you can actually do things like, for example, geographically weighted regression analysis, which allows you to look at the attributes of the built environment in a place and see where people are able or less able to make trips or have longer distances or whatever attributes you want. And you can look at that socio-demographically. So in this particular part of Merseyside, what happens is that people in the Birkenhead side of Liverpool are actually not really able to access services in the same way as they are in the dense urban neighbourhoods in Anfield, which is a city centre. So people in the city centre don't really have accessibility problems by transport at all. They can get to all of their activities affordably by walking mostly or by public transport. But in Birkenhead, what you see is that there's a neighbourhood effect, and that groups that live near the train station are actually able to go across the river and go to all of those opportunities, so don't have an accessibility problem. But the groups that don't live near a train station and are reliant on the bus services do have an accessibility problem, because they have to go much longer journey distances through the one tunnel under the river that is a very long journey time and long in terms of affordability as well. And in particular, single parents, which are down the bottom end of the Birkenhead side, on this side of the river, they particularly end up having to use cars, and they make much more frequent journeys, and they take many more trips because they have to actually ferry their children around all of the time in those cars. So they're a low-income group, and you can do this disaggregate analysis providing that you have the data. It must be said that in the UK, we're very bad at the moment in doing bespoke surveys. This was a very small survey that I undertook myself, but normally that Merseyside local authority would not have access to that type of data, and local travel surveys aren't done. And I think you have to have those local travel surveys to be able to do this type of analysis. I don't think you can just do potential. I think you have to look at travel behaviours as well. But actually there are some sort of definite pros and cons of the approach, and I think that we don't actually have accessibility standards. Now, you can see that might not be necessarily a really good thing, but actually quite often what you see is inappropriate calculations of journey times. So, for example, willingness to travel 45 minutes by public transport to a job, which most people on a low income wouldn't do, and it's completely inappropriate measure. So I do think you have to set standards by people's own values. There's usually only analysis for impact assessment, which is what the DFT guys, Ivan and Mark, were talking about. It's usually only on big, large projects, and so you don't actually look at accessibility for local projects, and particularly there's issues around deficits not being addressed because there's no funding to be addressed. And actually land use planning, in truth, is largely uncontrolled. So if somebody decides that they want to build nth amount of houses in the middle of somewhere where there isn't really very good public transport accessibility, in truth be told, nobody stops them. And also, there's nothing done about service closures. So if a hospital closes because it argues for it needs to do so for cost efficiency reasons, then nobody really stops it closing because people can't get accessibility to healthcare. And nobody builds a new hospital in order to improve their accessibility to healthcare. So there's all sorts of issues around the service sector, which is what I was trying to point out. I'm trying to go quite quickly because I know you will want your tea. So I think that there are contextual issues as well with accessibility planning. So I was alluding a little bit to this with your presentation, Cecilia, which is that actually contextually we have a largely commercialised bus network in the UK, and it's totally unstable and it keeps changing all the time. So improving accessibility with that background, that contextual, it's like chasing your own tail. It's impossible. There's grossly inadequate funding in the system for socially necessary transport. So if you see an accessibility deficit, you can't do anything about it because you've got no funding, right? There's lack of concessionary fares for certain groups, which means that you can't do anything about the affordability issue. Legislative difficulties, lack of stable funding systems. Transport is not conceptualised as a social policy problem. So when people are thinking about having social problems, they don't think about transport. Unemployment is largely not seen as a transport problem. Ill health is largely not seen as a transport problem. And there's not really proper metrics for the social impacts of transport policies at all. And then, so the second critique that I have is that it's a conceptual critique, and a little bit, I think, Carol, you were thinking about that. It's often not really about transport at all. It's actually about all sorts of other things. In the social inclusion arena, it's about having poor skills. It's about having other duties and responsibilities like childcare, which you can't do anything about. It's about housing and planning policy. And so, you know, that's not in the transport domain to do anything about. So unless you've got this joined up decision making that thinks about those things, you're not going to improve accessibility for some groups, or improving their accessibility is not going to improve their outcomes. It can be about transport, but not related to accessibility necessarily. So costs, issues of crime, comfort, all these other things that that Andre was talking about. But also I think there's a massive amount of things to do with transport disempowerment, the fact that actually in the UK little citizens don't have the opportunity to say what they need, what they want. And even if they do, how can you get over the fact that the loudest voices, like mine, get heard and the quiet voices do not? And that, in fact, it's by the nature that people who tend to be transport poor are also disaffected politically and they don't get involved in the planning process. And so what you hear is the fact that people want journey time savings. They don't want improved public transport in low-income areas because those people are not actually speaking about what they need and what they want. And then... Sorry, I've got your problem, Phil. I can see one thing and then not the other. And then there are methodological issues, which I think, personally, I think that the UK method focused too much on public places and public transport instead of actually thinking about first people and where they wanted to go and what they wanted to do. There's a lot of issues around homogeneity of local needs within an area. So you do a place-based assessment, you assume everyone's the same. You don't think about women, men, comparing young people with older people. They want different things. You don't have enough local knowledge about microservices like opening time. No point in having a bus that arrives at the doctor's surgery when the doctor's surgery is closed. You're assuming that you've got accessibility to healthcare, but you haven't at all because you can't use the surgery. So activity windows must be part of the assessment. You need to think about capabilities. So, for example, with your cycling analysis, you improved accessibility monumentally, but if all of those people living around there were old people, then they couldn't cycle, or they were too fat to cycle, or they were too young to cycle on their own. You haven't improved their accessibility at all. You've just included improved supply of the cycling network. And so you don't get these micro changes. And there's also this thing about capturing micro changes in the provisions of buses. So they change all the time in the UK and services get taken off and put on. So your analysis is just, you'd be there ever and a day trying to keep up with it because it's not a stable system. So finally, I just sort of say accessibility is, in this case, was about participation. And it's about connecting people. But not only that, it's about what people can actually do. If what you want inclusion is people have even participation, whatever, having access to something. If you can't do something there, you haven't got any money to buy something. So what's the point of having the access to the shop in the first place, right? And land use planning has to be part of this mix. You can't do anything about accessibility without it, and not just land use planning, but service planning. And it's all to do with the condition and quality of the connections as well, because you can put services on, but if people think that they have to travel too far, or it's uncomfortable, or it's unsafe, then all of those other things are part of their accessibility package, if you like. And accessibility and social inclusion, well, you can do some of it. You can do some of it, but you can't do everything. And so you're not expecting to necessarily have social inclusion outcomes, but you have to focus on the things that you can do something about. So in the evaluation of projects, you need to be thinking about people's, has the cognition of the system improved? Has the willingness to travel improved? Has the so-and-so, not necessarily has the employment levels in the area improved? And I think, again, that's that thing of opportunity measures versus outcome measures, which is a difficult one to come across. So hopefully, just a whistle-stop tour.